All right. Hey, what's going on, everybody? Welcome to our Restoration Success Webinar 2.0. I'm thrilled to have you all here today for this exciting and insightful session. This webinar is part 2 of our Restoration Success series, where we bring together industry leaders to share their expertise on key topics in the restoration field. I'm your host, Tenzin Wangjor. I'm the marketing director for KarmaStaff, and KarmaStaff is a proud sponsor of today's event. KarmaStaff specializes in providing top-tier remote staffing solutions to the restoration industry. Whether you're looking to grow your business, hire exceptional talent, or explore new strategies for success, you've come to the right place. Work on your business, not in your business, with KarmaStaff. So on behalf of KarmaStaff, I'd like to extend a heartfelt thank you to all of you for joining us today. And speaking of joining, we are fortunate to have two outstanding speakers, both leaders in their field. First, I'm honored to introduce Lisa Lavender. Lisa is the COO of Lever 360. Lever 360 is a union of iRestore restoration management software and RTI. She is also the COO of Burke's Fire Water Restorations in Reading, Pennsylvania. Lisa's extensive experience and multifaceted expertise have made her a highly respected figure in our industry. Today, she will share her insight with her topic, the power of clarity, defining expectation, and root cause analysis in restoration. Next, we have the pleasure of hearing from Laura Tygielski. Laura is the owner of 125 Managed Health and a recipient of the prestigious Founders Award that recognizes top-performing franchisees in the nation. Laura has achieved remarkable success as an entrepreneur and now as a consultant to other business owners looking to get the most out of their business. Today, she will be discussing on the topic restoration expense efficiency, saving on healthcare plan and payroll. So how this is going to work, we'll begin with Lisa's presentation. If you have any questions for either one of our speakers, please submit them in the Q&A session, and we'll address them in the dedicated Q&A time slot we have. After that, we'll be hosting a networking session where we'd love to hear from you, the attendees, about challenges or problems you're facing in your company. This will be an open forum for sharing experiences, and we'll explore whether there are others in the group who have faced similar issues and possibly find some solutions. So without further ado, let's dive right in with Lisa. Lisa, the floor is yours. Please share your screen when you are available. Amazing.
Awesome. Thank you, Tenzin. Really appreciate you and the Karma team putting this together. So thumbs up, we can see my screen okay? All right, so I warn everybody, I'm going to go fast because brevity is not my superpower, but I wanted to have an action-packed 15, 20 minutes for you. So power of clarity. Okay, so I'm going to hit some high-level things here and drill down on the functional analysis, identifying root causes. I'm going to touch upon the concept of a functional chart, talk about clearly defined expectations, how to bring this together to do an analysis and identify root causes, and you're going to get some quick tips along the way. So first, I want to kind of give you eyes on a functional chart. Can I see a thumbs up or a hand raise if you have built a functional chart for your organization? And when I say functional chart, I don't see any thumbs up or hand raises yet. Okay, so put this on your to-do list. When I say function, oh, Tenzin got one. Good job. I'm talking about functions, not people, not positions. Super important. And as you build out your functional chart, you'll see you may have these high-level functional areas. It may be general administration, production, project management. Under general administration, as I build out some of these sub-functions, you may see things like accounting, IT, human resources, just to give you, again, the visual of it. The benefits of charting are enormous. I had a mentor and friend really insist on me building out charts for my company, and it's been so helpful. It gives you clarity and other members of the team a lot of clarity. It helps you build out those accountabilities. Accountabilities oftentimes one of the root causes of why we're not getting the consistent results that we want. It helps the team, even with the day-to-day communications, understanding and seeing how all these functions are connected and tied together. It can increase our effectiveness in those functions, and just as a general operation, gives us a lot of flexibility. If somebody's on vacation or a team member leaves, we can identify the functions that they owned and quickly jump in and pick them up without missing too many steps. That's the goal. Really instrumental to scalability and growth. As you build out a functional chart, we started calling them the boxes, and how many boxes are we in? And sometimes if you're a 2-person or a 3-person company, you might say, I'm in all the boxes. And as your company grows, you may say, I'm still in too many boxes. And that's where we can start taking those boxes and breaking them down and giving them ownership. I like to use the word ownership to people and positions. But it really lays the groundwork for that. It helps us identify gaps, and it gives everybody confidence in the organization, seeing all those functions that are happening. This is just a worksheet level, and the KarmaStaff team has a copy of this. If this is a worksheet that would help you build out your functional chart, you can request it. But you can see these are typical areas that you may call in your restoration company. Again, I encourage people to use terms that resonate with your team. And as I built this out, production, that may be plant, vehicles, equipment, restoration, construction, if you have any auxiliary services. If I break down plant, vehicles, equipment, somebody could be responsible for vehicle management. Again, just to give you a visual. Production may do things like manage the resources of the company, scheduling and planning. These are all key functions. Developing staff. Project management may include estimating, collections, receivables. Program management. If I move to relationship development, that may include digital marketing, event coordination. Our general administrative bucket may include things like managing our insurance, which I think Laura's going to help us with soon here, payroll, incoming calls, accounts payable, the list goes on, right? So organizing all this stuff really helps us in a first step of bringing things together. And so now this is where we really have to buckle down, is to get these clearly defined expectations around everything. Very difficult to hold people accountable. And oftentimes when we do a root cause analysis, we may find that we didn't have a clearly defined expectation. So I'm going to ask everybody to relax for a moment. So close your eyes, look at them, and imagine one expectation in your company that may not be being met. One function, what expectation is not being met? And I really encourage you, if you don't mind sharing, type that into the chat box, because I want you to focus on that for the remainder of this presentation. That one thing. Is it the cleanliness of the warehouse? Is it the timeliness of follow-up calls? Is it job documentation in the job documentation file? Go ahead and maybe share in the chat box that one thing, that functional area that you were thinking of. And so when we talk about clearly defined expectations, I want to touch upon what the purpose is, the different characteristics, how we establish them, how they apply. And again, I want you to focus on one, because if we leave here and we just have some clarity and drive towards one, that's going to be helpful to us. So the purpose is clearly defined expectations help us drive success and results. For the company, they could be profit margins, it could be growth, it could be customer service scores. For individuals, and even for our customers, it helps us establish priorities, which we have 1,000 things going on in our day-to-days, and we have a lot of competing priorities. So having these things helps us and the team juggle and set them. It drives accountability. I mean, the biggest thing is we cannot consistently hold people accountable or expect them to do things when we weren't clear of what we expect. Thank you for sharing some of those. It helps us measure the outcomes. How do we know if somebody did a good job or a bad job? One of the most basic things that I like to refer to is time speak. A lot of people, we want to increase efficiency or our margins. Well, if we were going to increase efficiencies, we have to have time speak around everything. When I say time speak, you have 4 hours to do this project. That gives people an expectation of our proficiency and also sets those metrics. Whether it's a project, our scopes often get turned into hours. I have 200 hours to do this project. It could be something as simple as cleaning an air mover. We allow 7.5 minutes. Cleaning a dehumidifier, 15 minutes. Time speak. Somebody can't be fast or slow or talk to about that if we didn't set that expectation. I get very passionate about time speak. So I'll keep moving. So it drives that, it allows us to measure those outcomes, and it helps us communicate and all stay together. So if I have a client onboarding deadline. So if I'm in charge of onboarding somebody and I have 3 days to do that, everybody in the company, and I own that, can work around that best practice, communicate, build relationships, give people updates on that. If I own that, I should also be able to tell people, hey, everybody, I'm not meeting our agreed expectation because 20 things happen. I'm running at 5 days this week. That's helpful when we can all own these expectations and work around the same model. So they need to be clear. See, these are some of the characteristics. They have to be communicated. I find even with myself to this day, I have expectations that are floating in my head. Can I have a thumbs up or a hand raise if sometimes you realize something isn't coming out and you start thinking about it and you're like, oh, I never actually told anybody what my expectation is. So that's something that happens to all of us, but they can be visual, digital, etc. What do they apply to? Is it the function? Is it the task? Is it the result? Is it how to do something? There's lots of things these expectations could apply to. And then we have to be able to tell the person, the who, the job, organize them by job title. People, you see that word owning those functions. Is it everybody? Is it, sometimes it's everybody that you meet when you arrive at a customer's house. Everybody who arrives, introduce yourself and shake their hand and your team. That may be everybody who approaches a customer's house for the first time, but that's also very clear on what the expectation is. And then you need things. We can't just magically expect all of our expectations to be met. You need resources. You may need help from KarmaStaff. You may need skills, knowledge, information, tools to do it. And the list goes on and on of what we need to. And they have to be reasonable, everybody. So they have to be reasonable based on all this. Unreasonable expectations don't work. So what do they apply to? Well, they're kind of everywhere, which is when it can be so mind-boggling, but it's also fun. They could be found in work orders, signs, job descriptions, employee manuals, voice-to-voice instructions, lists, guidelines. There could be regulations. It could be something when reviewed in a meeting, checklists, SOPs, even our contracts. They're clearly communicating what we're going to deliver, the expectations, and what is expected of our customers. It could be payment terms, right? That's one we often find. There's a lot of things. And sometimes they exist in our mind, our cultural norms, our values. I love signs, right? This is an expression of an expectation. No expectations being clarified here. And this is one of my favorites. I dug up for many years ago. It was reported to me that somebody was putting boogies on a bathroom wall. And so, yes, we had to clarify the expectation is to not put boogers on the wall. Okay, that's my little funny for the moment. So this is an example of there was a big commercial, see something, say something. And a production manager I work very closely with was frustrated because people were seeing things but not letting him know, and they were important things. So he kind of started a movement. He made it a cultural norm that it's okay, it's safe if you see something, it could be, hey, somebody needs to go back. They left a mess on this job. It could be, you know, somebody's tire is flat. It could be anything, right? See something, say something. So he made it safe and just an ongoing initiative to make that expectation heard and communicated. So then we get into tools, templates, and what I call even work design. That helps us manage things to expectation. So this is an example of a field scoping sheet template. And if you notice, it's very deliberate. Our expectation for field scoping, I love using the words accurate and thorough because it actually does cover a lot, just saying accurate and thorough. So I think in restoration, our hope is that when we're doing field scoping and communicating back to the office is that it is accurate, which means everything is correct and thorough. We captured everything. So you'll notice that this is very deliberately designed. It's a job aid or it's work design. You can use different terms that support this, but you have to look at the ceiling and you have to say, is it affected or not affected? If it is unaffected, you move to the next box. But what that is doing is helping facilitate the expectation of thoroughness. Give me a thumbs up if that's making sense to everybody. Does that make sense? Kind of a thumbs up? All right, awesome. Thank you, Tenzin. Awesome. So again, work design. This is our software screen for taking a new job, just one screen. But if you notice, I can say this is a worksheet collecting the same information. It's a very deliberate, I don't have to break down every single field and say my expectation is that you get the mobile number and the email and that it's accurate. I can say using our worksheet or using our system that our company uses, you need to make sure that that is thorough and accurate when you take a new loss. So these are things of work design and tools that help us because that is our expectation, right? Our expectation is that we get all the information that we need and it's accurate, but that doesn't mean we don't create tools, systems, and job aids to help people. Again, my job update and to-do checklist. There's tools that we use, but if any of you have been I'll say victim or frustrated, I'll say frustrated by looking at a job note and it says left a message. Well, that wasn't really the point of the job update. We were supposed to have a meaningful conversation. There's a lot of missing information. I should also be looking at the project as a whole and evaluating different things that I may need to be responsible for. Many of you have seen this before. It's a sketch. And again, accurate and thorough. That's the best practice and guideline. So if this room was 15 feet, you failed the expectation of accurate. If I was missing this closet, that would be considered not thorough. And I'm giving you some words deliberately as you go back and look at maybe some of your expectations. This is just an example of a SOP. Even training, if you notice, I'm very passionate about having clear expectations around training. So when somebody is involved in training, signed up for a class, even now, if we had time, I would have went through this process, is what is the performance outcome? So my expectation after you take monitoring a water loss is to very specifically decrease the need to return to the site due to poor decision making and or lack of documentation. Improve the efficiency and effectiveness of next steps. Notice that they are very clear, measurable, increase, decrease. So how do we get them done? So everybody want to know that. Everyone wants a magic wand. Well, not that easy. We got to manage to that. So I'm going to go through some ways. There's lots of tools to manage. I already showed you some of them. I'm a big fan of best practices because those are the higher level things that I think are timeless. Best practices are the most important things that create the best outcomes. I always like to engage people by saying worst practices, and sometimes it's even good to create what? Worst outcomes. So we don't want that. So it's really easy to get everybody around it. And these can be the most important thing. They're not the detailed SOPs. They're not the detailed steps. They're just those high levels. Like, you know what? If we get a phone call, it gets returned within 1 hour during the business day. End of story. That's best practice, right? If we have any contact, you can use the word contact. And lots of things can change, but these are timeless things that are the most important. And you can see some samples up here. A lot of times revolve them in restoration companies around documentation, communication, timeliness of everything, the delivery of our products, the quality, etc. I'm going to go pretty fast here for our grand finale. This is a sample of an SOP. Again, if you want anything, reach out to Karma Group. I'm happy to share any things. I also just want to touch upon, because some of these things, I'm really big on these competencies, and they're often a pain point, especially as we're developing leaders. So again, bringing clarity around what our expectation is. So initiative, it's a very clear definition and continually strives to identify opportunities to improve upon individual organizational performance, thinks ahead, takes action to create opportunities for the future, is proactive. So this is very clear of what it is. And then throughout our company, we should be able to explain our expectation for that individual competency. Obviously, if you're a COO, the expectation is going to be much higher than if you're an entry level technician, for example. We encourage initiative and we can teach them that and groom that, but your expectation should be different. So, root cause of functional issues. Grand finale. Is there an expectation? Who's responsible? Does the person know that the person responsible know the expectation? Do we have consistent accountability? And does the person have the tools and the skills to meet the expectation? And this is this is another worksheet that I gave to the Karma team to share with you guys if it's helpful. It's a real simple process, but it helps us often quickly just break down, identify what we need to do. So I just want to show you how you would use this. What is your desired outcome? Just think of it that way versus what you want. So my example is, I want to make more money on some contracted services. The team is paying too much. And so is there an expectation? Yes. A minimum of 10% before 10 and 10. Is it who's responsible? We're going to call it the job foreman. Does that person know the expectation? And I know that sounds silly, but sometimes that's a little thing we miss. Is there a consistent accountability? No, that's often one of our problems. And do they have the tools and skills? And even as I reflect on that, I might say they need to develop their negotiation skills. And then we just come up with an action plan. So I'm going to just close on that note and just let everybody know it's never done. Like organizing the warehouse is clearly defining expectations. Your work is never done. Prioritize them and pick one today and get it ramped up. Thank you.
Thank you so much, Lisa. Thanks for sharing your expertise and valuable insights. Now we'll move on over to Laura for our presentation on restoration expense efficiency, saving on healthcare plan and payroll. Laura, please take it away.
Thank you very much. I'm going to share my screen with everybody here. A second. Here we go. Okay, so I got a little bit ahead of myself here. Oh. Can you guys all see my screen at this point?
Not right now.
Okay. Second. It's just showing you. Hold on. Sorry, you guys. This is what happens, this technology stuff. Let me grab it on here. Get it back up here. It's what happens when they won't cooperate with us. Let's see. Got it right here. Here we go. Okay. Okay, can everybody, here it comes.
Well, I can try sharing. I think I have your presentation. I can try sharing it and you can go through the presentation. You want to try that?
Okay, there it is. Wait a second. Here it comes.
Okay.
Here we are. Okay, can
Awesome.
everybody see that? Give me the thumbs up. Sorry about that. My internet, I'm kind of back and forth here. Okay, so we're going to go into a little bit. Everybody can see this. We're going to go into and talk about the managed health plan. I want to tell you guys, thank you for having me here today, Karma Staffing, and everyone just participating in this. My passion, I just want you guys to know, I was a multi-franchise owner, and one of my biggest setbacks and struggles was being able to provide medical coverage for my employees. I think now in this world, we need to be able to do this, but it is quite a struggle. Just the cost of providing the medical coverage was just out of reach for some employers. And plus you get the benefits and they can't afford their portion of it, so then they opt out. And I think participation rates now are about at 35 to 40%, even to those companies that are offering benefits to their employees. To me, that's just, we're missing out here. So that's why I got into this company and learned a lot about this. And I'm here to help businesses of all sizes. We look at companies usually with 20 or more employees is about the sweet spot. But for all those that are on this webinar today, I can make exceptions. So if you don't have those employees as I go through, just know that you are eligible for this program as well. So what we're doing is we're going to be talking about the managed health plan combined with the 125 tax code. It's a singular voluntary employee benefit plan that you can offer your employees at a zero net cost. Okay, so we're going to go into my little slideshow here. So the managed health is a preventative and wellness care. As we know today, a lot of people do not, they have a lot of health risks, chronic diseases, diabetes, things like that. If you're preventing and you're proactive about your health care, you're going to be healthier down the road. This is going to lead to better health outcomes. This is going to lead to just healthier employees altogether. And this is where we want to see our businesses and our companies going to. It's just ongoing education for your employees and coordination with their providers. If they have their own providers, this program will coincide with their regular medical coverage. Early detection, reduce costs for employees and employers. The reduced cost by detecting these health risks early kind of takes the strain off the employer's medical coverage, group coverage, if they have it. This is a great program, whether you provide your employees with medical coverage or you don't. It works either way. What it will do is it'll enhance what you have if you're providing benefits, or this will be an add-on to those benefits.
Hey, Laura,
Okay.
I think we're not able to see this. I think you're on the second slide. We're not able to see. We're still on the first slide. Could you try resharing it and then doing it one more time?
Okay, so it didn't click for you?
Yeah,
Nope.
I think you might have to try sharing it one more time.
All right. I'm going to hit stop sharing and I'm going to hit share again. Okay, can you see it now?
Yes. First slide.
Okay, so there's my first slide. You guys see that? Can you see the second slide that I was just talking about?
No.
Did it change for you? No?
Let me.
It's changing on my end.
Let me try this. Okay. Laura, I have the second page shared. I can take this. So you were in early detection?
Yes, managed health plan, the wellness care. I'm going to get out then. I'm going to go. Okay, there you are. You have it there for me. Okay,
Yes.
so we just talked more so about that, and we're going to go to the next slide, and we're going to talk about, there we go, the benefits. So I'm going to go into a little bit about the benefits for you, what these benefits look like. The big ones here for me are the zero copay on primary care visits. These are all in access where you go to an actual doctor. Urgent care visits, zero copay on the specialty visits, and it's 100% covered preventative services. So that is for the employee. The other ones that you see, click down, that will go through all those are for the whole family. So this is a plan for the employees and the family. With the zero copay primary care visits, that's a big one. If you go into a doctor, the big thing that I heard with my employees, they would miss work because they would get ill and they would say, I need to go to the doctor, but I can't afford the $90 copay. A lot of these programs have copays and they're very high. Here they use this plan, the managed health plan, whether you provide benefits or not, and they actually go in, show their card, they'll have an app, they show them that this is the managed health program. They will have a zero copay. That copay will totally be eliminated on urgent care, primary care, and specialty visits. That is huge. I've had a lot of people tell me that they won't go to the doctor just because of the copays and the cost of doing that. So they will opt out of going and they end up sicker. And this is why we have this in place so that these employees have the advantage to go there. Another thing that this really helped me with was kind of reducing my overall cost, my workers' comp. I would have, I had cleaning kind of a company there, and my employees would go ahead and they would go out on the weekend and play soccer, hurt themselves. They can't afford to go to the doctor. They don't have coverage. They'd come into work Monday morning and say, I slipped, getting out of, cleaning the floors and my ankles hurt. I need to go to the doctors. That claim then goes on to your workers' comp. By having this program in place for your employees, they can go, they're more apt to say, you know what, I just hurt myself. I'm going to go into the urgent care. This will also mitigate the cost to your primary health coverage if you're offering health coverage, because your employees will use these benefits first. This will pretty much save you on your renewals for the following year because you're not utilizing that program as much as you will be on the managed health program. The other big thing for me are the prescriptions. That we have 3,000 prescriptions at wholesale pricing. So your normal prescriptions like your diabetic supplies, blood, high blood pressure, those the main issues that people have, there is a discount wholesale pricing, and most people are getting their prescriptions for about $5 and under with this program. We all know that the prescription drug companies, they're making a lot of money and they're charging a lot of money for prescriptions. This is huge. You can go into your pharmacy as well. This is mostly for mailing out your prescriptions, but you can go into your pharmacy, show this card as well, and you'll get the better pricing on your medicines. My big thing here is the telehealth medicine, 24 hours a day, 7 days a week. We've had customers that have said this has saved us. Most of my employees were single mothers, little children at home, and they would get, during the middle of the night, that the child would have an awful cough. They'd call telemedicine. You get a doctor within 5 minutes. They talk to you. They go over everything. And if they feel that it's an emergency, of course, then they'll tell you we can't do this over the phone. But most of the time, it can be taken care of over the phone. Telemedicine is the new thing these days. So what will happen is they write a prescription. That mother goes to the pharmacy, gets their prescription. You don't have to go sit in a waiting room for hours and hours with other sick people. You do this all over the phone, the 24-hour, 7-day-a-week telemedicine. Also helps cut down your employees from calling out of work, because they can, middle of the night, they're not feeling well, they can, you know, call, get help, and they're more apt to return back to work quicker. The other one that I think is a big deal these days is the mental health. This is a kind of it's a 24/7 telehealth for mental health. I had a lot of my employees that it seems that the mental health issues are, you know, out there today, and I would have them calling and saying, I just can't come to work today. I need to go see my therapist. This was huge. I couldn't tell them enough. You need to be at work, you know, for your mental health. What if rent comes due and you don't have the money because you couldn't get into work? But they'd have to take a full day off to go see their therapist. Right here, they could do it 24 hours a day, 7 days a week. They can go in, get on that phone, make a phone call, middle of the night, they're having some kind of an, you know, emergency mental issue. They call, they get help. They get someone to talk to them. The care navigation, they will work with them. They will keep their file there. They can call them on a regular basis and have help, ongoing help for their mental health. So that's kind of the other is down. You'll see the managed health PE perks discount program. That's dental, vision, chiropractic, diabetic supplies, and the prescriptions. So that's an added perk to here. The dental vision is about a 60 to 80% savings. So what they would do is they go in, they make a dentist appointment, they show them their card, and as long as they're providers, the preferred providers, we have a whole list on our app on the preferred providers. You look it up, you find a preferred provider, you go to that dentist, you show them your card, and you will get a discount rate on that, as well as the chiropractic. So those are the overall benefits on the program. And we're going to go to the next slide, and we're going to talk a little bit about how, with combining that 125 with this managed health, will help with your FICA taxes. And it's about $500 per employee per year that it reduces your FICA taxes, which is huge. You know, we'll go over some numbers here, and I'll show you the savings that just by providing them with this these benefits will help. It reduces the healthcare spend. What happens is, if you're providing coverage for your employees, your comprehensive coverage, they actually will more likely use the managed health first, which then will steer the claims away from your medical plan and reduce your costs going forward with renewals, because your utilization on your program has been lowered. And I talked a little bit about the reduced workers' compensation spend. If they're able to go see a doctor, go to the urgent care, and it's a zero copay, they're more likely to do that than to try to figure out other ways of, you know, getting themselves back to work. So that one for me was huge. I know workers' comp in the field that you guys are in and that I was in was one of my you know, highest expenses, and by reducing that, I think, to me, just by hearing that is kind of what got me into learning more about the managed health. A lot of companies don't know about it. It's been out there forever. The bigger companies, a lot of the real big companies use this, and this is how they save on their FICA taxes. So we're getting the word out there to help the smaller mom and pop type companies that we are. Cost savings for the employees save about $240 per year on they'll get a little bit. So what happens is we take this out of their pre-tax dollars, so it actually will lower their taxable income, and once the cost and everything gets factored in, they actually receive a little bit more back on their paycheck as well. So they love that. They're going to use this program. It's a 95% participation rate with this program. just because of how easy the benefits are for them to use, and then it doesn't cost them a zero net cost out of their pocket, nothing out of their pocket that they'll see. Again, the reduced employee turnover spend. As we know, employees are hard to, once you get them, you have all the cost of training, you know, everything that goes into gaining these new employees. By having this program, you're adding extra incentive for them, and they love having it, and they're going to look at your company and say, wow, these benefits are really good. I'm going to stick right where I am instead of going down the street and working for another cleaning company, restoration company that's not offering these kind of benefits. So this to me is a big deal. I know that, you know, we know that if they're offering a little bit more money down the street or a little bit benefits program, that's where your employees are going to jump to. So this kind of helps reduce the employee turnover and helps with the cost of that for you. So this is just the table of savings. So say 50 employees, your annual potential savings is about $25,000. So you can just figure it, whatever size company you're at, you just times that by 500, because that's what you're saving per year per employee. And that is your potential annual savings. So what we do is we get those numbers from you, we meet together and we go over, and I literally will go over this program in detail, a one-on-one meeting to see if your company qualifies, to make sure that everything is in place and that this would benefit you. Trust me, I was a business owner, I am a business owner, and I'm not going to waste anybody's time here. This to me is one of the greatest health programs that you can provide your employees at a zero net cost. With our company, Managed Health, we remove the HR burden. We know that, again, you know, any kind of help you can get so you can work in your business and not on your business is huge. Program, we actually educate all the employees. We do the employee enrollment. We help with the program retention. We work with the employees and incentivize them to use the program. We do the payroll implementation. We have a whole team HR support that will answer any payroll questions that you have going along the way. Any employee questions, you send them our way. We will take care of all that during and after and all through the process of open enrollment. This is not like an open enrollment for major medical, because remember, this is not major medical. This is not for surgery, hospital, anything. This is just a you know, a program to use on top of what they have, their emergency services. But we will literally walk them through the process. They will have their own team. We educate them. They will have an app. They will have a card to be able to use this. And this is the first place they're going to go, I guarantee you. We have, again, a 95% participation rate on this program. And we do all the work, all the implementation, and we get, we actually send them videos every month so they can, on health and you know, diet and all that kind of stuff to kind of keep them engaged and motivated. So the program, you know, phenomenal, I'll tell you. So basically our steps for the program is step one, we gather, I would meet one-on-one with each company is what I do. And I go over, we do a Zoom meeting and I go over the full program, and it takes about 30 minutes, depending on questions as well, but I go through exactly how your paychecks are going to look and everything. So that's number one. I get some census data. I get a basic data about your employees. And at that point, we do a proposal. We meet again. I show you what your savings are going to look like, and I show you exactly what each employee's paychecks are going to look like with the additional money put in their pocket. So they're getting additional money, and they're also getting, you know, the benefits of this program. Then the third step is we do open enrollment. That's a phone call first. We meet together. We get the enrollment process going. This is not like a major medical program. So we can enroll any time of the year. It's not like, you know, with the major, everything has to be done in January, start date of January. We can do this at any point going on. So this is open enrollment, takes place any month of the year. And then we do payroll implementation. We walk your payroll department through how this plan works. I have my bookkeepers doing it for the companies I'm working for. We work side by side with some of the bigger payroll companies. But even small bookkeepers, they say maybe depending on the amount of employees, that this might take them an extra 5 minutes, and it's just some clicks of the button going forward. So it's nothing that takes a long period of time. It doesn't add a bunch of extra work for your human resource department. It's very easy to set up, and then we get it all done, and then the benefits go live. And your employees start to see the benefits of having the managed health program. And you will see the advantages by the FICA tax savings that you will get from having the program. And we take care of all that and make sure that it's all compliant as time goes on, and we do all the reporting and everything. So I like to say that because for me, having that extra work kind of would scare me in the sense, but it's all taken care of. We do everything for you. So with that being said, you know, I just want to thank you guys for being here today and caring enough about your business, you know, to take the step to listen to ways to save money. This is for our small businesses. This is huge. Now is the time to take advantage of this so you can start your savings in 2025. And if you have any more questions, get a hold of the KarmaStaff, and they will give you my information. And then I will set up a time, and we will do a one-on-one where I can go more through the process and the program and exactly how it works. So that, for me, I'm done. I'm going to give it back to you guys.
All right. Thank you so much for that. So right now, thank you again to Lisa and Laura, both of you guys. It was really, really insightful. So as we conclude, I'll kind of want to take some time for a Q&A session. We did have a question by Patrick earlier on, and I think this was geared towards Lisa. And the question asks about increasing efficiency and its effect on being able to complete a task when you're rushing. So Lisa, can you speak on that?
Absolutely. So, and a lot of times when I've spoke to efficiency, I'll get some of that. And it is never, being efficient is never at the sacrifice of quality. So we want to it's really kind of determining the optimal, the most efficient. Sometimes it's even, I'll use a very simple in contents processing is moving the trash can close to us so we're not walking trash, or staging the things we're going to process. On a job site or with a trade and skill, a lot of what we're doing, you know, whether it's writing an estimate, you know, I do Excel spreadsheets, whether it's finishing drywall, there's a point of what we would call proficiency. So again, it's an expectation of somebody. It takes time. You get faster and faster as you practice. So it's really about skill development and where we consider somebody proficient when we're doing that time speak. So efficiency is not about sacrificing quality. It's about how can we reduce movements? We want to engage the team's proficiency. Another common pain point that we see sometimes in the operation is just multiple supply runs. So that's just inefficient, doesn't affect the quality per se. I don't know if I answered that well enough, or if there's any follow-up.
Yes, Patrick, if you need any clarification, please just, add that to the Q&A session.
Yeah.
And we have another question, I think, geared towards you, Lisa. It says, if I use technology as a work design, how long does it take to get everyone on board and using it properly? So
Yes,
I
get a lot of questions about that because there's all kinds of technology and tools out there for us. And I kind of encourage people to start depending on what it is, because it could be our operating software is very expansive. It could be a tool to digitally survey people. There's lots of different digital tools and technology out there. Even equipment is has technology and is advancing. And so where we want to kind of break it down is, and nobody likes this answer, but I always say it depends. So do we have workflows? Do we have those clearly defined expectations? Do we have a work design and we're just using these tools and technology to enhance it, to streamline, to get it faster, better, cheaper, as many people will say? Or are we doing two things? So if we're using field documentation tools or technology, well, were we already really good at field documentation? Was it part of our process, our culture, and the way our people were trained and engaged? It makes it a lot easier and a lot faster. So it really depends on the tech, what area of the operation it's hitting, where we're at. But the key is to get it fast is whoever's implementing it and owns that implementation is to think through all elements and have a really solid plan, from training to changing just behaviors, understanding what exactly are we implementing besides just possibly the tech.
Okay, thank you so much for that. And Laura, I had a question for you. I think during your presentation, you mentioned the $0 copay for mental health services, and I think recently there's been a much more stronger emphasis on people's mental health, and I'm sure it has a lot of residual effects on their physical health as well. So have you noticed kind of more emphasis on mental health, and is that part of the why that's kind of implemented in this program?
Definitely for me, that was a big why for me. That was one of my biggest, I would say, frustrations in owning my business was when, the mental health. Like I said, I had a lot of employees miss a lot of work from, the mental health issues. And I think by them having the ability to get help and reducing their costs, I mean, the cost of therapists is astronomical these days. And just by them being able to do and have as many conversations as they need with somebody, and it not costing them anything, they're more apt to going and having the help that they need.
Right. Yeah, I know a lot of big healthcare agencies don't offer mental health as any of their coverage plans. So that's, I think, extremely good to hear about that.
Yeah.
I think there are no more questions in the Q&A section. As we conclude, I'd like to let everyone know that we'll be sending out a follow-up email that will contain the contact details of our speakers. Some of the information that you saw here today will also be shared with you guys, and also a feedback form for our webinar.